I was referred to hydrotherapy, which is physical therapy within a therapeutic pool, over 2 years ago. And the waiting list is so long that it took this long to get accepted. And unintentionally, I have pinned so much hope on the hydrotherapy as a way to eliminate some of the pain that I'm feeling in my muscles. I was not expecting any improvement from hydrotherapy. I was only looking at it as a way to feel some kind of relief when it comes to the pain. However, what happened was nothing like I've expected. So it was my first and my last sessions for many reasons. First, to get inside the pool, it takes a lot of effort in a way. Going through the secretary, I needed to see a nurse that would check every bit of the patient's body to see if there are pressure sores or open wounds that would affect the patient's safety while they are within the hydrotherapy. I was initially afraid of the fact that I have epilepsy and that they would ask for clearance from my hepatologist, to which I have not seen in maybe a couple of years now, because I have so many medical conditions to follow up with that I just haven't seen him. And to get an appointment with the hepatologist, it takes so much time. And I was lucky that they have overlooked this. They checked with the nurse that I have nothing that would hinder my safety regarding open wounds and pressure sores. And they also asked about the bowel movements. They do that to everybody. If the patient has control over their bowel movement and urination. And the pool, the setting itself has a physical therapist in the pool and one or two assistants to that physical therapist. And I was on the wheelchair. Of course, I can barely stand at this point. They had me move from my wheelchair to another wheelchair that is built in for the hydrotherapy with straps and everything. And it was lowered down the pool slowly, and then the assistant helped me to unbuckle myself, and there was bars along the pool and a lot of other tools. Of course, there was no way that I could take pictures because there's a lot of privacy when it comes to hydrotherapy. The width of the hydro pool was enough to cover up until my neck right here. But there was no way that I could go further away from the bars of the pool because I cannot walk. So all the way I was just holding on to the bar, and the physical therapist told me, try to walk sideways. And then she left me completely. It was exactly like this. She told me, walk sideways, and then she went to the group because it's a group that consists of 8 to 10 patients at a time, and the session lasts for half an hour. And she told me this, and I was barely trying to hold on to the bars because I can barely lift my knees at this point. I don't know how to bend them. I don't know how to hold my body straight. I struggle to keep my gait as straight as I can, even with the bars and all the equipment that they have. It was such a struggle. So I was really trying to walk sideways. I was really, really trying. But what happened is the the smell of the pool, the bleach, which I have forgotten about completely, has caused me almost immediately to cough and causing my chest muscles to go spastic and to have my airways restricted almost immediately. And the increased humidity inside the pool as it is locked also contributed to my migraine that was switched on almost immediately once I was inside as a result of the reflecting lights on the pool itself, because there's lights on the top, and I could not tolerate the movement of the water, the little wave when the other patients would move or I would move. The movement of the water, the reflection of the lights on the pool itself, the smell of the bleach, and the thing that I had no idea that it would affect me is the skin condition that I have talked about previously, which is the shedding of my skin, that it looks like I have dandruff on my entire body, and I still don't know why this is happening. Probably deficiency in one of the minerals that was never investigated thoroughly. So once I was inside the pool, it felt like I was swimming inside acid. So it was pain like I was dipped into acid. It was very, very painful. So to take all those factors, my migraine was switched on almost immediately once I was there, and I had a very, very, very bad headache, to which it increased my spasticity almost immediately, and I had a lot of difficulty trying to hold on to the bar and apply what the physical therapist has asked me to do. And then she came again while I was still struggling and barely able to speak to her, because there was also music and a lot of sound and splashing water from the other patients and the physical therapist, that I could barely talk, and she would barely give me the time and the patience to listen to me and to know what I want, what I need. So the next time she came to me and she told me, now stop walking side to side and try to do like a bicycle inside the water like this with your feet. So you kind of hold on to the bar with one hand, try to float. There's so much water, so it's so much width. And you try to do a bicycle with both feet or legs, to which I could barely do because I cannot bend my knees, and I was in so much pain that once she turned her back to me, I was like, oh my god, I cannot do this, and I know my limits very well. I could not do this. So I just tried to float and relax my body to see if I can do it within like 5 minutes. However, my eyelids started getting spastic because of the reflection of the water, and my eyelids would shut down while my eyebrows would go up with like a spastic. As my forehead would get spastic upwards, and my eyelids would go spastic downwards. So my eyes would be shutting down. I could not concentrate. My migraine kicked in fairly quickly and very aggressively. I could not concentrate because of the pain. I had a lot of nausea as a result of the migraine. I had, on top of the music that it was so loud and the splashing water, I had the tinnitus and the ringing in my ears so loud with the migraine, and my eyes kept shutting down. So all of this, and on top of the pain from my skin, contributed to the fact that I could not even focus enough to do the exercises that I was supposed to do. And then I was shocked to see how quickly the session was when the physical therapist told me, time's up, you need to go. I rate that as -5 out of 10. It is not suitable for me at all. And I left the treatment. I had another session after that, and then another session, and then a physical therapy, a regular physical therapy. And the physical therapist tried the usual bending knee exercises to which we have been trying for the past 2 months. And I could not do them, and I could not walk, and I could not support my body to stand up as well as I'm supposed to. I kept declining from the session before, and with tears in my eyes, I informed her, like, I really thought, despite the fact that I did not enjoy or find the hydro pool effective, I was hoping that I was imagining and that it would have some kind of a relieving effect on my muscles, that it would make the physical therapy session easier. However, it didn't. And so I had to inform the secretary to completely discontinue the hydrotherapy, as there is no way to accommodate the hydrotherapy based on my needs when it comes to the smell and the sound and the timing and the focus on one patient. There's no way that they would put just one therapist only for me. It's too much accommodation for them. So I told them, if you can do it, discontinue the treatment, to which they did. And this is how it was, the first and the very last hydrotherapy for me. I hope this would work for those who need it, but for me, sadly, it didn't.